Good afternoon. Thank you all very much for taking the time to join us. My name is Chad Left-Harris. I'm the Chief Executive Officer of UCI Health System, and it's my privilege to be with you this afternoon. And on behalf of the What Matters to Me and Why Organizing Committee, the Advisory Council on Campus for Climate, Culture, and Inclusion, UCI School of Medicine, and UCI Health, it is our pleasure to welcome you to another edition of What Matters to Me and Why Talk. As co-workers and faculty and residents, physicians, fellows, and students, we spend so much of our time here with exams and lectures or clinical practice and so many other topics, doing the things that are so required of us to keep the university, the medical center, the health system, and all of our careers running smoothly. What matters to me and why is a chance to stop for just a moment and take a break from the usual frenetic pace of activities. And these talks have really given us the opportunity to hear from people who shape UCI through their daily activities. Speakers normally give a short, informal talk, followed by ample time for questions and discussion. So there really is no prescribed topic. So we're a little bit of freestyle here. Speakers are asked to answer the question, what matters to you and why, authentically and frankly, and then we see where it goes from there. The series provides a forum of speakers to talk about values, beliefs, motivations, and perhaps to share how they've been shaped by their personal experiences, including highs and lows that they've encountered along the way. And our hope is to strengthen the bonds between faculty and students and coworkers who discover, teach, and heal here all together, and celebrate both the diversity of this community and the commonalities that we have that bind us together. Because this series attracts an audience from all over UCI, it's our tradition to give you a minute to introduce yourselves to your neighbors. But now that we're in the Zoom era of COVID, we'll use the magic of breakout rooms to split you into smaller groups very, very quickly. We're going to take 60 seconds to do that, to say hello to your neighbor, and then bring you right back into the larger room for the main event. So Will, if you're ready, you're the magician, so take us away. All right, Will, you think we have everyone back in? All right, we'll go ahead and go. Thank you all for doing that. That was fun. Thank you for making the magic happen behind the scenes. Always great to meet people, and look forward to doing it when we can do it in person. So welcome back. Hopefully you enjoyed that. So we kicked off What Matters to Me and Why, the Medical Center Series in 2019 with the Associate Vice Chancellor for Education, Con Von Lee Buckland, and Department of Family Medicine Chair, Cindy Hopp. Then followed by Patient Flow Director, Iman Othman in 2020. All of our talks, including this one, will be filmed. And you can find previous videos on the What Matters to Me and Why website if you happen to miss them or want to go back. And I see Rachel just included that in the chat, so thank you, Rachel. In addition, you will receive a survey after the event. We do take feedback very seriously, so please take a minute to complete that. And any suggestions you have for future speakers, so please send us any suggestions you may have. So if you would complete that and submit it, we would greatly appreciate it. It is important that we hear a diverse perspective of voices for this entire series. And this opportunity is open to anyone at any level or any area across the broader UCI. So don't limit your thinking as you think about potential other speakers. And so now it's my great pleasure to welcome Dr. Shruti Gohil. And I see her out there in Zoom land. So Dr. Gohil is an assistant professor in the Division of Infectious Diseases in the UCI School of Medicine and Associate Medical Director of Epidemiology and Infection Prevention. She earned her medical doctorate from Tufts University School of Medicine, completed her residency in internal medicine at UC Davis, and had a clinical and research fellowship in infectious diseases at the Albert Einstein School of Medicine in New York City. Dr. Gohil's research focuses on infection prevention, antibiotic stewardship. She's led several large-scale epidemiologic studies evaluating patient risk for sepsis and hospital readmissions. She has created a novel scoring system to identify high-risk patients to prevent central line-associated bloodstream infections, and is currently lead investigator of 4 large randomized control trials that develop a precision medicine approach to empiric antibiotic selection. In her current administrative role, she's leading UCI's health response to this little thing known as the pandemic, including clinical and epidemiologic assessment of healthcare worker and patient management, COVID testing, exposure definition, response, contact, I mean, the list goes on, Dr. Gohil. And I like to say that while UCI Health was made for this exact moment in time of this pandemic, it's because of people like you being here. And we're so fortunate to have you. Please join me in welcoming Dr. Shruti Gohil to the virtual podium to share what matters to her and why. Take it away.
Great. Thank you so much, Chad, for that. And I'm going to go ahead and share my screen. And it's a real pleasure to be here. And when I was first asked about this talk, I thought, well, you know, I'm not sure that I have, I'm in a stage in my career that I really fully have put everything together. And I'm sure that this talk would change where I'm more senior in my career. But I'm taking this opportunity because it seems really really important for me to talk about how it is that I ended up doing what I do and see if I can be, my experiences could be of any service to our patients or to our healthcare workers who take care of patients all the time. So the mission of Uc Irvine, as you all know, is discover, teach, and heal. And I'll be touching on these sort of sporadically throughout the talk and using them as guideposts to organize what I have to share. So somebody really, really, really smart told me to just have fun. So I decided to do that. And anybody who knows much about me knows that I really love music. Music is a binding force through my life and my family's life. And amongst the top, of course, would be Bob Dylan. I'm a definite Bob Dylan fan. And this is him in his doing his recording actually for the song Like a Rolling Stone. And so my early life really was a lot of Rolling Stone type of experience, lots of circuitous paths. I was born in Maryland. My father was a civil engineer and working for the Army Corps and for the government. And so when there would be any kind of emergency, anything that required his engineering skills, we'd be sort of deployed to some other location. So I've been to a lot of places, you know, Mississippi, Vicksburg, Pittsburgh, New Orleans, multiple schools within each of those cities that we traveled to. And so between the ages of 5 and 8, I changed schools maybe 7 times at a minimum. I think my dad, I asked him, how many times? He couldn't even remember, but it was about 2 to 3 times per year. So every 6 months, you just pick up and leave and go to a new location. And my first full year of schooling was really in the 5th grade until we finally settled into a final new place for a couple more years, starting the 6th grade. And so you learn a lot of stuff, you know, and this is no different from so many people who go through this, you know, people who are in diplomatic positions and have their kids traveling all over the world, or people who are missionaries. So, but some of the things that we have in common, I think, would be, you know, the idea of resilience. You know, you have to deal with a lot of uncertainty. Circumstances are constantly shifting, and you need to know how to roll with it. And you land in a new place, and you have your, you know, what tools do you have? You have the tools and powers of observation, and you assess the field, you assess the players, you learn a little bit of EQ, you recalibrate, and then you come up with a response. And little did I know back then that years later I'd end up in this field of hospital infection prevention, where my job includes responding to pandemics, things that are really uncertain and risky, and boy, those skills just came in so handy. I also, around this time, around when I was 8, ended up getting some early lessons in gratitude. So in the middle of all these, you know, places that we were going to, one of the places I ended up was in India, where my family is from. I was born in Maryland, but my parents and all of our extended family were in India. And so we went to go visit, and my mom had gone traveling with her other parts of the family, and I had stayed with my grandparents and uncles and aunts in the western part of Gujarat. And so there was a rain, and it was heavy enough of a rain that that a little kid like me, who was 8, could swim. And I happened to be one of the few people who could swim, who had the swimming skills. And so I went ahead and did that. And that wasn't wise. There was nobody there to tell me no. But I ended up getting sick a couple weeks later, got sick. I knew that my urine had been turning some funny colors, you know, turn Coca-Cola color, and that I wasn't feeling quite right. I was quite tired. Finally, I got a fever. And then I started talking gibberish, just altered mental status and the whole thing. And I couldn't move. I couldn't move my arms and legs, and my eyes had turned yellow. My skin had turned yellow, and a doctor had been called, and he said, boy, she really is in critical condition. And that you really, you don't have much time here. Get this one medicine at the pharmacy. Go to this one clinic. And it was like a very rural, no, I wouldn't call it rural, but a community setting in India, not a hospital. And so I just remember being in some small room with blue painted walls and somebody injecting me, IM, with a bunch intramuscular, with a bunch of some medication. I can't imagine what it could have been. But that doctor, whoever it was that recognized the entity, unclear level of training. But we know one thing, that people who don't have that many resources, doctors who don't have so many resources, are forced to use their powers of observation and to think on the spot and to be really well clinically trained, actually phenomenally well. They just can't they can't rely on the kind of tools that we have, to and CT scan. So anyway, whatever he had recommended did something for me. Looking back, I am an infectious disease doctor now, and looking back at all the signs and symptoms and the epidemiology of what could it have been that I had contracted, and it would be severe acute hepatitis A, fulminant hepatitis A, and probably with encephalopathic consequence. And that entity, without supportive care, often can lead to a mortality ranging in the 50 to 80% range. So pretty big. I was little at that time, but I sure remember a lot of it. And I do remember feeling like, okay, this is big. My mom's not here. I could die. Just give her the information that I love everybody and all that. So at a young age when something like that happens, you realize quickly that your time is bought. And I appreciated that much, and that there's a weird duality between everything feeling both weighty and light at the same time. That really gives you a veneer of unreality in your day-to-day moments. So much so that you're able to kind of pull back in any kind of situation and kind of have a sense of humor, because at the end you realize that none of it really matters all that much, and the sky is not falling, we're okay, and that it's better just to laugh if you can. So this is Bob Dylan. He's in the recording studio here on Hard Rain's Gonna Fall, and this is an epic song. If anybody has heard this, I strongly urge you to check it out, or to at least see Patti Smith's rendition when he was given the Nobel Prize in Literature. She gives this amazing performance, so check that out if you can. So the only constant in all this movement around when I was a kid, the only constant really was around libraries and books. Schooling was plus and minus. My parents were really attentive, and they sort of helped us along as much as they possibly could. But our access to books really was in the library. So I went to a lot of libraries in a lot of different places, and I discovered this real deep love for reading and for writing. And so much so that I decided, this is what I want to do. I want to become a writer, maybe a journalist or some such. And when it came time to applying, I'd been the editor of a school paper and thought, this is won a few contests, and I thought, okay, this is it. So it came time to apply, and of course, everybody knows, anybody who's inculcated in South Asian culture or Asian culture, that being a doctor is it, right? I mean, be doing something that you can make money in, but also help people and do some good stuff, for the community. That's really the holy grail. And so I've been told as a young kid, medicine is the career for you, and you should do this. And but I never knew if it was my thing or their thing. And meanwhile, I loved comparative literature, and so I went ahead and chose UC Irvine. Back then, it was one of the top schools in the nation for humanities. I got a full scholarship, and several schools in humanities, and I had the great privilege of learning from some people, some pretty famous people in that world at that time, and was really inspired, and had gotten somewhere with my writing skills, and was very much encouraged to pursue that path by people I looked up to. So I thought, okay, well, why don't I try my hand at this? And meanwhile, let me see about this biological sciences, because I know my parents mean a lot to them too. And to be honest, I've always loved science as well. Then there was a chance encounter. This is a great song by Bob Dylan. This is actually a picture from his first recording first live recording of Simple Twist of Fate, another outstanding song. But so I happened to go to Barnes & Noble to pick up my GRE and my exam book, prep book, and I ran into one of my grad students that was teaching at that time, a grad student for Reality of Place. I kid you not, that was the name of the class I was taking, and she said, "Wow," she was behind the counter and it was a cashier. And she said, "Whoa, you're really thinking about this as a career." And I don't know if I caught somebody in their wrong moment and wrong time. And she really said, let's get some coffee and talk about this. And she was just in a bad place and said, but this is a career that if you're doing it just because you love reading and love writing, I don't know, because you can just do that. But is it really what you want to do as a career and be writing, writing literary theory and all this? And around the same time, I took it in. I wasn't sure about that perspective, but I took it in. And then around the same time, a couple months within that time, I'd been picking up a friend who was working at a homeless clinic. And we were supposed to go out, and she was taking a little longer than we had time for. And so I went into the clinic to check out what was going on, and it was just crazy. It was crazy. There was one doctor, one nurse, and it was her. It was all she was doing. And so she said, well, if you want to, get done quickly, come on, pitch in, and she could hand me an intake form. And hours later, I loved it. I realized, oh my gosh, this is great. And could my parents actually be right about this thing? And so then I applied, and I didn't tell them. I applied without telling them, because in case I got in, I wanted to make sure I was the owner of the decision. So I applied, and then I thought, okay, well, this will be my way of knowing. It's really hard to get in medical school, and if I don't get in, then great, I'm going to do my PhD. That's what's going to happen to me. And then I did get in. And it felt like, I should go. So I went, and so glad I did. Absolutely love it. I couldn't pick a better field for myself, and ended up doing a whole bunch of rerouting as well, more circuitous paths. Fast forward, I'm pinging back and forth between the coasts. I went to residency at UC Davis, and specifically I picked programs that were known for their clinical experience. I realized that learning through a textbook can be done at any time, and things will change. And but that the clinical skills, the fundamentals of observation, and putting things together in your head, and then coming out with something that makes sense for a patient, that's something that can't be taught so well through books. And so I picked some programs. I'm just pleased to say I was so lucky because I ran into some really, really great clinicians, including Faith Fitzgerald, and if you happen to know her, and many others. During residency, I realized, oh my gosh, I love infectious disease. I ended up in infectious disease research fellowship in New York, and for a variety of reasons, including my husband, then boyfriend. And then things were going well. I joined a research program with some well-reputed immunopathogenesis researchers, and then got offered a research attending ID position that would be fully funded for research for a couple of years, and then some opportunity to help lead the transplant infectious disease team there. And by that time, I had my first kid, and things were going well. And then my husband gets an offer, a great offer. He is a law professor and got an offer to join the UCI clinical law faculty to really spearhead some clinical work here. And that's a rare opportunity of a founding clinical faculty type of opportunity. And by that time, I was getting, really tired of the snow. Brooklyn was hard. Brooklyn's Bronx is hard, and a big expense. And so UCI it was. And so I came out to UCI, and there's no real position for me in ID at that time. I needed to pay my loans back. I knew I loved patient care. So I went ahead and took that job with primary care, and of course enjoyed it a lot. I always thought maybe I'll do some research, but was trying to reorient myself and figure out, how am I going to put the pieces together to maybe do some clinical research, maybe in different fields, but related somehow to immunopathogenesis. I knew some people at UCLA, and so then before I had left Einstein, I had asked my mentors, hey, is there anybody in specific that you would recommend that I reach out to about research? And the name Susan Huang had come up, and she was doing infection prevention, and we had met, and she's an amazing person. And at that time, my head was very clearly in immunopathogenesis and transplant ID, and I thought, I just don't know anything about infection prevention. I don't know how that would work with what I do. It's such a big shift. But after a couple of years, our paths crossed again, and somehow, like all great mentors, she saw something in me that I didn't see in myself, and I transitioned into this new exciting field of infection prevention with the promise of a path towards research, completely different from my prior work and my prior research, or even in the world of ID. And so just as I was about to transition into this field, our family was hit with a new challenge. So here's my son. He's my elder son, who at the time was around 2 o'clock. This is 2 years old. He was, this is in New York. He was born 4 pounds, 4.5 pounds at term for a variety of reasons, including fellowship and 2 trains and 2 buses back and forth between the Brooklyn and Bronx. But he recovered from being, low birth weight and all that, and was thriving for a couple of years. But soon after I started my new job here in infection prevention, he developed some severe eczema. It started with a bit of eczema, progressively worsening over 15 months, that then became just refractory. I mean, we had topical steroids and progressed to this erythroderma that just, he would turn red, and his skin would just fall off. Every night, find a bunch of skin on the floor. Husband and I would take turns at night, sort of keeping his hands away from his face to make sure he didn't scratch himself, to bleeding and his whole body. And we saw lots of doctors, all kinds of doctors, right, all over Southern California and beyond. And he had, simultaneous to this skin issue, of course, developed this sort of a food allergic presentation, where he basically, we were told that he could barely eat anything. He's allergic to everything except for blueberries, mango, any kind of meat. We're vegetarian, and gluten-free grains like sorghum and teff and amaranth and all this other stuff. So I remember starting this new job and thinking, oh gosh, how am I going to do all this? And also, take care of this poor kid who, I'd wake up at night and bake bread, out of sorghum and amaranth, and, let it rise and do all the things that bread needs to do. Because at that time, you didn't have as many gluten-free or allergen-free options. And so I knew in the back of my head that he is our cyclosporin and steroids. Cyclosporin is a heavy-duty chemotherapeutic for those who are joining us who don't know. And so I knew on the inside that a lot of what was happening to him the treatments that he was getting, not addressing the fundamental issue in him. What was the pathophysiology of this disease, and how is it that we were in this place that it was so refractory? And the fact that he was lighting up on all of these tests, immunologic tests, the very kinds of assays that I used to run in a lab on, in a bench during my research, and I know full well the weaknesses of those, which include cross-reactivity and false positivity and all that. So I knew all this stuff, but I didn't want to be that crazy physician mom, right? Who goes in and says, no, I demand, that you look somewhere else or do something else. And I had kind of taken a step back because I figured, okay, maybe I'm not thinking correctly about the whole thing. These guys are experts and all that. And it was unfortunate. I knew that hydrotherapy was probably going to help him a lot, and I couldn't find a place that would really admit him because he didn't meet admission requirements, right? And then finally went to a dermatologist, a pretty prominent dermatologist at an academic center, and the recommendation was for methotrexate, and I said, you know what, I'm done. So I think we're going to look somewhere else. Understanding, I didn't talk about what my training was like, but in residency, I was lucky. I joined a program in residency that had to do with being able to follow patients inside the hospital, uninsured, homeless patients sometimes, and then see them in clinic and back and forth. And there was a cadre of 5 or 6 of us, categorical residents, internal medicine, who would do medicine kind of the old way, and we would communicate with each other our issues with our patient. And we would, when they would get admitted, it would be whoever was on our team, and we all knew the patients intimately well. They weren't just a snapshot in time. They were people that we understood. And in the clinic, we didn't have access to specialists, and so we learned a whole heck of a lot of things about subspecialty level things. And so that was really helpful. And I knew some bit of dermatology and some bit of other things. And so we were lucky. I reached out to some friends at NIH and other places, and they pointed me to the National Jewish Eczema Center in Colorado. And this is a program you have to get into. You have to apply, show and prove that you really need their help. People come from all over the world, and this Donald Leon is a great figure in allergy and immunology and pioneered some basic efforts. And you're in the hands of an expert. You're in the hands of an artist. When it comes to medicine, when they really just kind of get the issues, get the whole problem. There's a holistic approach to what is wrong fundamentally with the kid. So the first thing they did is take them off all meds gone. Of course, antihistamines have to be gone so they can properly assess. But one of the first things he said is, those tests just completely, no, we're going to open up his diet because it's all cross-reactive antibody. And we're just going to just challenge him right here. We've got the ICU here. We just keep giving him food. And so it was 24 hours that he would be in wet dressings as well. And the fundamental understanding of the fundamental issue is that an eczema, you can't hold water. You can't retain water in the skin. And so they would lube him up with a bunch of emollients and after soaking him in water, and 3 times a day water dressings. And he did really well. And again, the holistic thing, when as a doctor, I was very fixated on sepsis. He'd been admitted for sepsis a couple times. I was fixated on his skin and his nutrition, and I knew about the blood. When he would play Legos, he would crack, his skin would crack, and he'd get, he'd bleed. But I wasn't thinking what that meant for physical therapy, for occupational therapy. So one of the things that they did at this program was to do Ptot assessments. So they did that and they said, hey, he's behind on his motor skills by 2 years or something. And so this is a great song, Bob Dylan. This is a single cover, Bob Dylan's. And behind every beautiful thing, there is some kind of pain. Boy, isn't that the truth? So we enrolled him in piano and guitar and all that. He's doing great now. And this is him. On his guitar, he writes songs, and he's a beautiful thing did come out of such a tough circumstance. But there are some things that could be learned there. That my training has prepared me. For all of us, training has prepared you or all of your life experiences prepares you to really respond to the moment at the time. It took me a little too long to trust it, but gut instinct and clinical training, a lot of those things actually do matter. Sometimes it can hurt if you make the wrong assumptions, but they do matter. And the observations of the clinician really are, we all live in a construct of what we've experienced, what we've been trained by, and what we know and understand the fundamentals of knowledge. And we as a clinician to see patients in a snapshot of time. And it's really hard to just make a judgment by that. And I think one of the biggest things I like to stress is that it's really important to get the context, the full context of a patient's life experiences with whatever it is they are dealing with. And the other big learning lesson, which I'd always really understood very well, but this really came to heart, which is that tools in medicine are just that. They're just tools. You're supposed to use them, bring them together, and tie everything together. And with everything that you have, all the knowledge you have in your brain and your experience, bring it all together and approach whether it's research or whether it's medicine with an investigative mindset, with an earnest desire to find the answer and find the answer that's going to work the best. So in keeping with the Discover, Teach, Heal, I wanted to make sure I put in a slide on teaching and learning. And, it really is two sides of one coin. That learning really is in the eye of the beholder. You're talking to somebody who early on had some questionable early learning, training between the ages of 5 and 8, moves around a lot. So, everything that I learned, a lot of what I learned was all about what I was going to get out of any given experience, what it had to hold for me, and to take that in. And the best teacher in medicine, in my opinion, is your patient. And we really struggle with work hours that, working too hard and too long is no good. But it really is the number of patients that you see and the experiences that you have. And maybe it's not the number, and maybe it's the amount of awareness you bring to any given moment when you see a patient and try to put them together in your head. And you can't do either of these things, teaching or learning, very well without humility. Some people see humility as a sign of weakness, but for me, it's really about how much are you able to get into the mind of the learner, get your ego out of the way, and learn about what the learner may be missing, and sort of fill in that gap. And then opposite, as a learner, if your ego is too big, you can't get the info in your head properly, and that's really dangerous at times. So I'm going to almost end with this humanities and medicine, that also are two sides of one coin, and context really, 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 really matters. And that's what the humanities help us do. I would argue that my training in comparative literature and the humanities really helped me to get a strong foundation in the things that aren't in medical textbooks. It taught me how to contextualize things, to make connections, to critically appraise things, any situation, and to investigate. So now I spend most of my time in epidemiology and infection prevention and in research, is trying to understand how to recognize patterns of pathogen spread, how to investigate what puts people at risk, and how we can mitigate that risk. And there's a whole lot of uncertainty to what we do. Hour to hour, day to day, especially in the setting of emerging infectious diseases, but also in clinical medicine, right? We deal with this all the time in medicine. And for that matter, honestly, in the current national moment that we find ourselves in, lots of uncertainty as well. And so at the end of the day, what matters to me most is really how well can we holistically bring to bear all of our knowledge, our science, training, and experience together to sort of deal with that uncertainty and to deliver the best possible care and the best possible strategy for that's demanded at that moment. And so with that, I'm going to end with this final picture of Bob Dylan. There he is. So he had just had his motorcycle accident and gone into hiding, and amazing basement tapes, right, come out of this time period. And this was taken in 1970 at the sighting in the Lower East Side of Manhattan. And if you're going in hiding, it's probably not where you want to go, is the Lower East Side in Manhattan. But anyway, he's there. He doesn't look like he's hiding to me anymore. He's smiling. And so, here's a quote. It's a wicked life, but what the hell? The stars ain't falling. Going to Acapulco. This is from that great song called "Going to Acapulco." Gonna have some fun. And I just want to end with that. The fundamental idea that this is all we have. Just have fun, and no matter how bad things are getting, it really could possibly get worse. And so, with that knowledge, you have two choices: choose the path of being happy with what you have. And that's all I have to share today.
Dr. Gohil, thank you. Thank you so much. That was really poignant. I like. Well, first of all, sorry I was a couple minutes late, and I apologize for my dog barking, but my lawn guys are here right at the right time. They're getting him excited. But, thank you for the poignant story about your son, and I can only imagine how difficult that was at that time. But it certainly looks like he's thriving now, and we're grateful for that. I'm sure you are as well, of course. I like the sort of dual message of humility and humanity. That was what I took out of that, at least to some degree. And I couldn't agree with you more. I think that's fantastic. We have to maintain our humanity. Of course, it's so easy to get carried away with the technical components of what we do and the knowledge base. But at the end of the day, it's a person sitting in front of us or in need. And I really like the comment you made about, I think you said something like the clinical experience is a snapshot in time. And I think that's really so important. So I'd love for you to expand on that a little more, what you mean by that. I think I know, but I'd love to hear your explanation. And we would encourage everybody who was attending, we had 75 people, to please go in the chat and ask any questions or make any comments you'd like.
Yeah, so the snapshot in time is really meant about this increasing pressure that we all have as clinicians. There's so many patients with so many needs, and the more complex that our technical understanding becomes, that even more cuts into the time that we can spend with patients. So that I totally respect that. And you have to be efficient, you have to be sharp, and I think that we see patients, okay, what's the reality? We go into a clinic, we are booked with whatever, 20, 30 patients, and you get, on the books, you've got like 30 minutes, but you might really even have 15 minutes, and you see them for that one snapshot in time, but they have a whole lived experience of what it means to be sick and what the collateral impacts of all of those things are, whether it's your job, whether it's your family dynamics, or whether it is truly just physical pain. And if you don't ask the question, right, I think what it is about, even if you have very little time, by respecting that there's a whole lived experience that you have to understand in the patient so you can treat them right. I think that consciousness will allow you to hone in on the sharpest part of your skill set, that you can ask the right question at the right time and observe with your full knowledge base, the universe of ideas in your head and experience. You see a patient, and I think that ability for you to pick up on observations about that patient will trigger, if you just stop for a second, will trigger, if you listen to the patient's words and you're looking at them, and you'll trigger the right questions. And that, I think that awareness, bringing that into the moment of the idea of a context, allows you over time to build these sort of closer relationships and understand fully who you're treating and what you're going to look for next time. Whether you know it or not, whether you intend it or not, I think it works. Just open yourself up. I think that's what I meant.
I love that. And I think you can draw an analogy between today's event, which is what matters to me, and your patient, right? What matters to me, meaning what matters to the patient, right? Because we sometimes make assumptions about what matters to the patient, but if you don't ask them, how can you possibly know?
Brilliant, yeah.
So we have a question that just popped up from Deborah Nielsen. Thank you. Do you feel healthcare in the U.S. will move towards more of a holistic approach to healthcare, which is less costly, or will it continue with specialists which can be very expensive? Or is there a happy medium? Love your thoughts.
Oh, it's so hard because, I'm always trying to find that happy medium. And I think that the more that we know and the more that we understand, the more that science advances. I love the scientific advancement, the aspects of research and how much we can understand about people and how close we can get to diagnostics and understanding what's wrong with people. We have to continue that path and we have to go in that direction. The question I have, what really brings it together for me is that, okay, fine, let's bring it on. Let's have the investigations and be as forthcoming in our research as possible, but take all of that and throw it into a context. That's the art. And I think that as new technologies come out, just like with COVID, we saw this happening, unfolding in front of our eyes, right? We saw new tests coming in. We saw new approaches coming in and new data coming in. And the ability to parse out what was studied well, what was understood well, and sit on the decades of experience that we all sit on and arrive on, and on this moment, to put that all together, very few people were doing that, in my opinion, including at the top journals. And so what saves us, in my opinion, is that holistic approach is absolutely what we need to go towards. I think that the definition of holistic needs to be expanded so that we aren't seeing things, we really are seeing them as holistic and not mutually exclusive, so that we're folding in, okay, well, how do we critically appraise emerging research or data? Long answer, sorry.
No, I love that. I think you're exactly right. They're not conflicting at all. I think the implication might have been that specialization gets away from holistic, but I think it's our job as educators to actually make sure it doesn't, that it's not mutually exclusive. In fact, it should be inclusive. I think we're building out the medical humanities program along with our campus colleagues. So I think that's so critically important. So thank you. Another question we got was, can you speak to how mentorship has contributed to your journey and how you, if you would, pay it forward?
Oh, yeah, absolutely. So I appreciate that question very much. I have the privilege of working with somebody who is, Susan Huang. She's a global entity in the world of infection prevention, not just reputable for her research, but her ability to really synthesize and put information together in a way that makes sense, and that is novel, actually, that thinking process that she does every time that she approaches anything. Yes, this the ability of a mentor. Here I am, a totally different type of field. I don't have anything about infection prevention in me, and then moving into this field, she really did have to mentor me through the approaches. And so I can't say enough. Without that, I don't know what I would have done. I think I would have done something. But her ability to really coach is not just unique, but also critically important. And yes, do I plan to pay it back? Absolutely. Yes, I hope to. I do have some people that I'm hoping to help out with their journeys and have begun to do that, but I can only hope to be half of what my mentors have been.
Well, I think you have mentored a lot of people more than you realize, and that's not uncommon. It's interesting how when you run across medical students, and then when you get to be a little more experienced, like some of us, years later, they come back to you after they're finished with their journey, or farther along their journey, I should say, and they tell you how impactful you were, and you don't even remember them or their name. It's humbling, quite frankly, because what you do every day does impact a lot of people. So you've set a golden example. Your reputation speaks for itself, and we're just so thrilled that you're part of our organization. And so you are mentoring on a daily basis. I'll just say that. And then there's formal mentorship, which is what you're, I think, getting at. So that's fantastic, Shruti. Thank you. So we have a couple of really more specific questions to you. Now, I'll put them together, right? If you were not in medicine, what other field or career would you have considered? I think you talked about that a little bit, but maybe a little expansion. Then what are your goals? That's a little more concrete of a question that someone asked.
Oh, gee. Yeah, if I were not in medicine, yeah. I really do think I would have done something in critical theory or in something with writing, and ideally something in poetry or magic realism, if I could have had that kind of talent. but that's not it right there. And what are my long-term goals? Definitely centered around research. I'm working on some studies that will help us predict the risk of multi-drug resistant organisms. And I'm hoping that in the long run, all of the experience I get can develop into a research program that allows us to understand patients who are at risk for infection, predict their risk, and respond in both not just a protocolized way, but in a way that really puts into perspective the trajectory of their disease over the long run, long-term outcomes. That would be a goal. And I know that that's vague, but without getting into more detail, I don't know how to say it in a short way.
I think that was great for being put on the spot. It's, last question, I think, because we are getting close to the end of the hour. And this is a great question from Daphne Lay. What will be the biggest thing we've learned from this pandemic? What will we remember 50 years from now, or even 20 years from now, both from your field and in terms of, human civilization or society?
Oh, gosh. I do think that the community and culture level responsibility of doing what you need to do to protect yourself and others. We've always talked about hospital infection prevention. It's been a big field. Infection prevention in general has been a big field. But this community infection prevention behavior, I think that's big. I don't know that everybody's going to be talking about that, but I think people in my field are going to be talking about that. The idea that wearing masks, and of course, culturally in Asia, wearing masks is seen as a true act of community, a community act. It's selfish for you not to be wearing a mask because you don't want to be spreading your germs around. And hoping that perhaps we as a community, as a medical community, have understood that, as silly as it sounds, washing your hands, keeping your germs to yourself, wearing a mask, even in community settings. So might COVID come and go, but guess what? We get the flu every year. We get lots of things. Pandemics happen every couple of years, usually 3 to 5 years or so at the earliest. And so, this is not going to go away. And with climate change and many other things on the horizon, we expect that we will face more and more of this. And so I wonder if this is a change in trajectory, like the 8 ball when you're playing pool, that that we all as a community, as a world, perhaps may be thinking more in a community way, and how can we make that happen? I think that's what I would say.
Thank you. One comment from Carrie Hemp said, "Thank you for the wonderful comments, and most especially for encouraging us to constantly find joy, even in difficult moments such as the present." Thank you, Carrie. And on that note, I think I'm going to pull out and dust off my old Bob Dylan albums and play them again,
Please do. We should listen.
Once again, thank you very much to Dr. Gohil for her insightful words and really for being our featured speaker today and being unafraid to put herself out there for all of us. We really, we get so much out of these What Matters to Me and Why programs. And I'd also like to thank the What Matters to Me and Why Organizing Committee and the Advisory Council on Campus Climate, Culture, and Inclusion for their support in bringing this program to UCI Health. Please check your emails for an announcement about our upcoming spring 2021 speaker, as well as a survey about this event. In fact, I think there might have been a survey put into the chat, but there also will be one available probably by emails as well. We'd love your honest feedback, and we'd love your future speaker suggestions, although we have already a running list of people that we just can't wait to hear from. So please complete that. And thank you all for joining us today. We greatly appreciate it. And thank you to Chad for kicking off. I apologize. I was delayed getting here because of a unavoidable conflict, but I did get on right after you started. So I got the full Gohil. Thank you very much, Dr. Gohil. Bye-bye.
Thank you very much, everybody. Bye.